It's important to avoid pulling teeth in most cases. Pulling teeth has two detrimental effects on facial appearance. First is that uh, you can wind up with a small smile. So if the patient has crowded teeth and you need to make room, you subtract, say, 4 teeth, one in each corner of the mouth, and then you straighten the teeth and the extra spaces collapse together, then the patient can wind up with a smaller smile than would be would be pleasing. That doesn't always show up if the patient is 12 years old, but sometimes by adulthood, that small smile, as the face grows, the small smile becomes more and more apparent. By removing 4 teeth, then often you wind up with extra space. The extra spaces gather together, which on the one hand makes a small smile, but on the other hand, what's not always obvious until maybe afterwards is that as you gather the teeth together, you move the front teeth, upper and lower front teeth, back. So in profile, it looks like the under the nose, between the nose and chin, it looks like the mouth is kind of caved in. We saw that especially years ago when almost everyone had 4 teeth removed when they went to the orthodontist. Unfortunately, sometimes that's still done. Sometimes people stick to the old ways. Um, and so there was a kind of classic, what we called the orthodontic look in those days, with when the lips were pushed back. And so it makes the nose and chin more prominent, which isn't always beneficial from an appearance standpoint. So those are two big reasons. Another reason is that, I mean, who would want to have their teeth pulled? So you have a 12-year-old child who's in school, has friends, and then you say, okay, we'd like to pull 4 of your teeth. I wouldn't want to have that done, and I can imagine most kids wouldn't. Fortunately, by starting orthodontic early, almost all extraction or pulling teeth can be avoided. And the way we avoid that is by really expanding the mouth, making the mouth big enough to hold the teeth. So if there's crowding and the mouth is small, we can expand it and wind up with enough space to straighten the teeth. Another thing that we do is use elastics in the mouth to adjust the bite. So if the bite is off, we can use expansion and elastics to line things up. In some cases, if expansion is done and the teeth are already positioned too far forward in the mouth, expansion can make the teeth really stand out, really be very far forward. Maybe the smile wouldn't be too large, but the common term that we used to use for that, or the common term that is used for that, is buck teeth. You can imagine teeth that are just positioned too far forward. So they can be straight, lined up, and look nice, but if they're forward and you can't get your lips closed, that wouldn't be a good thing. So that's another very specific case. There are some other reasons that you might remove permanent teeth. One is some patients actually have extra teeth. That's very uncommon, but if they did, if a patient had duplicate teeth, it might be the treatment plan we might choose is to remove the extra teeth. Another case that we would consider extraction is occasionally patients have teeth that develop very far out of position, so far out of position that bringing them into position might jeopardize the health of that tooth or adjacent teeth. There again, that's a condition that's unlikely but can occur. If there's a mismatch of the bite, if the upper teeth are positioned very far forward, 2 teeth could be removed from the upper arch, so those upper front teeth could be moved back into the space provided by those teeth. Once again, an uncommon position, an uncommon situation. And the final consideration we've all heard of, and that is, oh, I have wisdom teeth that have to be removed. And so sometimes that's true. Sometimes wisdom teeth can jeopardize the health of the remaining permanent teeth, and so they're removed for that reason.